I'm Stephanie. I'm with 9 Health, and we're here today. I'm with Elisa Cook. She's one of our 9 Health Fair volunteers, and we're at the Susan Duncan YMCA in Arvada. We're going to talk about their health fair coming up and all the things you can kind of get at a health fair. And Elisa is a medical coordinator and has served as a phlebotomist as well, which is a person who draws blood. So we're going to talk to her all about that in just a moment. But I want to remind you, this is Health Happens. We do this every week on Facebook on Tuesdays at 11 a.m. to give you objective health information that you can use. Last week we had a fun one. We were at a chocolate shop and we were talking about dark chocolate and if it's good for you and talking about the science behind all that. It was very tasty and a fun one, but it is on our Facebook page and on 9healthfair.org. If you missed that, go ahead and check that out. It was a fun one for Valentine's Day. But now let's get into health fairs. We're approaching the health fair season. April is kind of when everything kicks off. April 14th is when the health fair will be here. And the health fair is a great way to just live a healthier life, get screenings for free, get low-cost screenings just to get all your numbers checked out and be on your way to a healthier you. So, Elisa, I just wanted to talk with you, and I think getting blood drawn can be an intimidating thing for some people. And I want to talk to you about what is a phlebotomist, and just tell us that first, and how someone can become a phlebotomist if they want to, because we're also in need of volunteers to draw blood as well.
Correct. A phlebotomist is a person that's been trained or skilled on how to draw blood or take blood samples from a person. It is used with a needle, so people don't like needles.
Right. Yeah.
To become a phlebotomist, there's definitely different ways. Any community college, usually your bigger colleges will provide it, and then your technical schools. I got mine through my MA for a medical assistant program, but they do offer classes outside of schools. And it's usually about a month and 2 weeks to get certified. And then, of course, you have 2 weeks of clinicals.
So it doesn't take too long to become a phlebotomist, someone who's skilled at drawing blood, and can be one of the most valuable volunteers we have at a 9 Health Fair, because a lot of people come to get their blood drawn and get those numbers. So for someone who is coming to a 9 Health Fair to get their blood drawn and they're nervous about it, kind of describe, or maybe they've never had it done before, describe the procedure for getting your blood drawn and things that people can do to make it less scary.
Less scary. Getting your blood drawn is very nervous. I know a lot of people that get really nervous, and it's okay. Nobody likes needles, and you definitely don't want to get stuck with one. So when you come in, you're going to register. You're going to fill out all your paperwork and select, what processes or blood tests you'd like, and then you're going to pay for that. After that, you're going to enter into the 9 Health Fair, and we have definitely other screenings you can do before, just kind of calm down. Drink lots of water that morning, just to help kind of hydrate you.
And we were talking about before we came on, not just the morning before,
right,
but the couple days before. And why is that?
If you start drinking a couple days before, it gets into your system and your tissues and into the blood. It also expands a little bit on your veins, so it's easier to draw your blood.
Okay. So
if you're dehydrated, it constricts them, and so they're just harder to get a needle in.
Okay, so yeah, drink water, make your veins easier to find. That's a good tip to make it less stressful and less painful.
Right. Nobody wants to get stuck once, let alone twice.
Right, yeah.
Yeah. So when you come in, we have tables set up with phlebotomy, or phlebotomist, and they're going to draw your blood, so you kind of wait in that line. Usually that line can be pretty long at places, depending on what time. Once you get into our station, we have you sit down. I introduce myself. My name's Elisa, and I look at your paperwork. I get your information, make sure I have your last name, first name. I have the correct date of birth, and then we're ordering and getting the right tests. I don't want to, you have to come back. So we do that. Kind of get you calmed down a little bit. If you have any questions or needs, please ask us. We can help you. If you need to lay down, we can do that too.
Okay.
So instead of picking you up off the floor.
They're all about trying to make it easier, and it is important for you to get all of your numbers and get everything checked out as a baseline for health, for sure. Right. So I didn't explain the little dog on the table.
Yep.
This is my son's stuffed animal. His name is Buttons. We brought him to kind of help demonstrate when you come in what it looks like getting your blood drawn. So we were going to draw Buttons' blood to see how he's doing. So Elisa's going to help us out and kind of set him up, and kind of you'll get to see what it looks like the day of the fair.
I'm going to give him a little chair just so he doesn't fall. He's going to fall anyway.
And we talked about even too bringing a friend or having someone with you, talk to them, be distracted while someone's drawing your blood. And
yes, they're always a good distraction. They can hold your hand.
Yes.
We can't always hold your hand. Normally we'll wash our hands. I don't have any hand sanitizer. And then I do put all of my gloves on. I do line up all your tubes so that all of them are in place before I start.
Okay.
Just so that I'm not reaching all over with a needle in your arm. that's not fun.
And how
either.
much blood are you taking? Does it depend just on what they've wanted done with their blood panel?
Pretty much depends on what they've ordered. I believe we have we have a total of 4 tubes that we're doing, unless you're at a site where we're doing a rheumatoid arthritis, and that's a separate tube.
Okay.
Other than that, the most would be 5 or 4, depends on what test you're getting.
Okay.
We are doing a couple new ones, so that requires just a different test that we run, not a separate needle.
Okay.
So I'm going to have them sit down. Usually I will have them hold just one of my stress balls. Oh, he doesn't have any thumbs.
On the hand you're drawing blood on?
Yeah,
To
just
squeeze.
kind of calms them down, and if they're shaking, it just gives them a focal point.
Okay.
Then I come in and, first I'm going to check their arm. Make sure their needle, where they're comfortable. If they have a preferred arm that they like, we draw on there. Usually your patients will know what arm they like or what works better. And if you're brand new, I'm not going to draw something if I don't think I'm going to do it. I don't want to stick you my way. So we're going to find your needle, and then we're going to clean it with alcohol. Let that dry. Then I'm going to take a needle and it's going to attach to what we call a hub. And then we put the tubes in the bottom of that so that it just kind of keeps it all in place. And then after you get all that screwed in there, you open up your needle. The bottom half is going to be on a tube.
Yeah, it's all right, Buttons. It'll just take a second.
Don't get nervous.
Just a poke?
And then we're going to clean. Yep, just a poke. And that's about it.
If Buttons can do it, you can do it.
Right?
Easy peasy.
Right? And little Buttons tends to move. So once that's over, we're going to recap that.
And about how long does it take to get 4 or 5 tubes out of someone? Is that
usually a couple minutes.
Okay.
If we're having problems and it's just a slower, where sometimes you just don't get the blood to run fast enough, it'll take a little bit.
Okay.
We like to use gravity to help us. So.
Okay. So getting blood drawn is obviously key to a health fair. That's one of the biggest things that people come to the health fair for. But there's other volunteers and other positions that we do need volunteers for. And you're medical coordinator for the Susan Duncan YMCA site. Talk about what other volunteers you use and need, both medical and not medical.
We are running here. We're running a couple tests. So we've gotten volunteers and doctors. We get pharmacists. If you want to donate your services, so we have spine check. We also do blood pressure, height and weight. We do pulse ox to check your oxygen in your system. Then there's several different educations where they'll go through. We have a diabetic education table this year, which is new, and she's going to go over, some pointers and tips and who to talk to about controlling diabetes. Other than that, any of our medical facilities, like if we were having a fair at like a hospital, of course they're going to have different fairs because they have the equipment we don't.
Right.
So if you're looking for a specific screening, just look them up. There are lists of screenings on each health.
Yeah, and on ninthhealthfair.org, if you click on Find a Fair, you can find a fair near you and see what screenings are available at that particular one and kind of decide where you want to go, or go to multiple. Use the resources that we are giving to you. And then the blood panels are $35 if people want to just get the regular blood panel drawn.
Correct.
But then there's also some different ones that I printed them off here. There's some different ones that you can add on as well. Can you talk about the additional things that you can do with your blood? Your blood chemistry screening, is $35. Gives you blood glucose, cholesterol, electrolytes, liver, kidney, thyroid, information on all of that. So that is great to have. And then I think for $20 this year, you can do your blood type. Or $30. So blood type it's something you only need to know or need to find out once because it doesn't change. But why is it good to know your blood type? Can you talk about that?
If you were to get into a car accident or you're gonna, cut yourself and you go into the hospital, if you already know what it is, they're gonna type it anyway. But then if you were to get you needed a transfusion or other additional blood, you already knew what it was. They wouldn't have to. It would take a lot longer if they have to type it. So if you already know, it'd be quicker to save your life or get you patched back up.
Okay. And you can do blood count screening for $25. It measures white blood cells, red blood cells, platelets, just checking your body's ability to fight infection.
Right.
And then the other one that we do is the high sensitivity, I cannot say that word, the CRP, HSCRP, we'll just say its acronym, for $35. Defines risk for cardiovascular disease, high blood pressure, high cholesterol, that kind of thing. That's another good screening to
And that one's new this year.
to get done. Right, yeah.
So that's a good test.
Is that added on to the blood panel? Do you have to take additional?
No, it's added into a test that we already run. We just separate that into that test.
So it's still the 4 or 5 tubes of blood.
Yep.
You can get all these things done that you would like. Are there any questions that we have from Facebook?
Yes, we have a question about the type of needle. Do we usually use a butterfly needle or just a conventional needle?
We use both.
Okay.
So we have both available.
What would be the reason for using one or the other?
The conventional is people that have lucky veins. It's just it's a 25, so those are the numbers of the needles, so it's a little bit bigger, but those will go into your veins up here. We use the butterfly, tend to be in more of your hand, or if you have smaller needles, a lot of elderly and children.
Smaller veins for that needle.
That way you're not going through the vein, but you can still access the blood, and it's not so painful. We're not trying to go through the vein.
Right, yeah.
So a couple needles we have options for.
Okay.
Yeah.
Any other questions? All right, is there anything else that you wanted to add about the fair that you guys are doing here? I did want to ask you too, you said you've been volunteering for 6 years when we talked?
This is my 6th year.
And what's your favorite part about volunteering? Why do you keep doing it?
I like the interaction with people. I love to give those services where they need it. And I do this for a living as well as on site. It's deep to me. I have a passion for it. I love helping people out. People that don't like to go to the doctors will come here because it is a screening and we're not looking for other things, but it's a basic start into your health. And so I do like to be part of that.
Yeah.
And I like to educate people on how important it is to get them checked, to disappear and get them not done.
Right, yes. And thank you so much for volunteering.
Oh, you're
for
very
continuing
welcome.
to volunteer.
I love it.
And we would not be able to function, and the 9 health fairs would not happen with all of our volunteers. So
No.
that we do depend on them. And if you want to get involved, again, if you want to go to a health fair, go to 9healthfair.org and click on Find a Fair. Or if you want to be a volunteer and help out, same thing, go to 9healthfair.org, click on Volunteer, and you can sign up to volunteer and get information about doing that. Both medical, non-medical. We just need hands to help out. So please go and check that out. And if there's not any other questions from Facebook, I think we will be done here. All right. Thank you so much, Elisa.
Thank you. It's nice to meet you.
Nice to meet you.